Well, in this video, we'll try to understand why are some of the patients of diabetes treated by giving injections of insulin, and I'll be giving you a detailed understanding. Before I begin, let me tell you what insulin does and how it is working. Well, insulin is a hormone that helps you manage blood sugar levels. One of the primary role of it is to help you unlock the doors of the cell to make sure that the glucose which is running in your blood enters into the cell. That is the key role that it works primarily. And what could be the possible reason why any diabetic might have been put under insulin units, maybe morning, evening, afternoon, depending on the doctor who will prescribe you, who will take care of your health, is going to make the dosage and other aspects of the prescription part. But why basically is it a given? Well, there are multiple reasons, and I'll be laying out specifically 5 reasons to you. The number one reason is because your body stops making insulin. This is something that we see very much predominantly in type 1 diabetics, where their pancreas stops producing insulin, and hence they need to be dependent on external insulin. So there is no reversible of or remission of type 1 diabetes, and people will be not able to be on oral medication or XYZ. They will be mostly dependent on insulin and external insulin that is being injected to them. And that is for type 1 diabetics, as their pancreas are not producing insulin. Whereas when we come to type 2 diabetes, eventually what happens is that maybe the pancreas get weak. The pancreas does not produce enough amount of insulin that is required for your body. And then people or the doctors eventually start putting you on the insulin prescription. And that is one of the reasons for type 2 diabetics. And you have been a diabetic for a longer period and you are on oral medication. Gradually your dosages increases. When the dosages increase, the higher and higher the dosage goes up. Eventually there comes a point where you will be put on just the insulin because you are not responding to the oral medication. And that is the third point. Having high sugar, despite you taking medicines, doctor puts you on an oral medicine, maybe metformin, maybe other XYZ multiple medicines, but still your body is not responding to those medicines. And you will end up with, high blood sugar level. Then the doctor takes a call that, sir, medicine is not working for you. We'll take a call and we'll put you on insulin units. And that is how the insulin is injected to the person eventually in the course of his diabetes, when he becomes a diabetic in the journey of being a diabetic also. The fourth reason could be possibly is because during surgery or any illness, to keep your blood sugar level in control is very much important. As what happens is that when they are doing a surgery, the healing process, if your blood sugar level is high, the healing process takes a longer duration. And that is not going to help you recover fast. Also, you will be prone to infection. You will be prone to multiple complications of diabetes along with the surgery, whatever issues that you are going through. So that is when the doctors takes a call, puts you on insulin for a certain period of time, and eventually they'll take a call depending on whether you need to be sticking to insulin furthermore, or you need to taper it down, or you need to take it out of your lifestyle. So that all depends on your doctor, but they take a call when you are going under surgery. If it is high, they bring it back to control by taking or by injecting insulin to you. The number 5th one is very specifically for female pregnancy with diabetes. What happens is that woman, when she is pregnant, she might end up having, the diabetes specifically. And that is why having high blood sugar level, again, leads to multiple complications during the birth, during the process of the labor and other aspects of it. So that is why doctors try to bring down the high blood sugar levels down by using insulin. So these were the 5 reasons why doctors or why you are being put on insulin injections in your diabetes management. So this is something that I wanted to educate you. There is a purpose and reason behind it, and you need to understand that. Make sure that my recommendation would be try to prevent as much as possible. Try to avoid going to the insulin scenario or being insulin dependent person, because as we all know, the side effects and the multiple complications will arise furthermore if you don't control your diabetes or keep the blood sugar levels in normal range. So prevention is better than cure, and that is what you need to understand and take away from this video, which I would be suggesting you. The only person who's going to take care of your health is you, and prevention is way more important than cure that you are expecting through external medicines that you are seeking through. So take care of your health primarily to avoid all the complications in the near future.